This is an information session on how to be a treatment coordinator and who is going to be the treatment coordinator and why we need one. Okay? If you're already acting as one, you're going to get some from the course, but I'm going to encourage treatment coordination and case presentation techniques in every dental office with appropriate atmosphere to engage patients, to give them options. If you don't give them to them and they have to ask you, they might as well ask Google. So what we try to do is educate previous to asking. I train that live. So if we're doing the treatment coordinator course or we're in your office as a treatment coordinator, I do it live for you so that you can see how I present a treatment versus how you would present it, and then together we come up with a happy middle somewhere. I was a dental assistant when I first graduated, then I became management, then I became a treatment coordinator, and then I became a consultant because I was excellent at implementing, executing, and maintaining systems, and case presentation was my passion. And this is only what I lecture. I have other trainers that lecture other things, but treatment coordination is what it's about for me in dentistry because I know it like the back of my hand. Knowing dentistry like that, you should be a case presenter. But you have to know it like the back of your hand. Everything about what your dentist does, how he does it, how long it takes, and how well he does it. You have to know it. Some professionals have guilt and fear that they make too much. So, because that's what someone told them. Dentists make a lot of money. It's not true. It's not true. Our overhead is 70%. Our overhead could be low as 65, as high as 75%. So it's not the reality. Just because they charge $1,000 for the bridge, nobody knows what the expense of that bridge was. Nor do they care. They don't want to hear about it. Right? How are you going to convince them that you need 3 months? Scaling. That's the hard part. Isn't it?
Yes.
It's the hard part. Because what do they ask when you tell them 3 months? Why? Right? Why? So if they ask why, they didn't have any value before they asked the question. We have to reevaluate how we communicated and re-educate every single time and give them options. Giving options gives them the ability to make choices. Everybody wants a choice. So my goal is to educate before I hear the word why. It's all to do with the communication. Whether you're a good communicator or it doesn't matter if you are or you're not, but you need to have somebody that is, which is a properly trained treatment coordinator or presenter. You can limit your access with the dentist. If you have a very good treatment coordinator, the last person they thank is you. The only person they want to see when they come in for treatment is you. Do I sell one $25,000 case a month? Yes, easily. On a patient of yours. How would I do that? It's based on confidence. We're way too busy going way too fast, booking not enough time to educate because we think time is money and it's not. A treatment coordinator keeps patients informed and alleviates time spent from the dentist explaining options. The dentist should not be explaining options. They do a diagnosis, they sit with the treatment coordinator, they go over that. The treatment coordinator, you have one in your office? No? The treatment coordinator educates the patient after you have allowed it. You pass it over to them. Would a dentist charge them $100 for a consult? No. They would do it in the operatory, which has probably cost us $300. A treatment presenter increases the number of patients who accept treatment plans. Guaranteed. Guaranteed. There is nobody that could prove to me otherwise, unless you had a poor treatment coordinator, or untrained treatment coordinator, or somebody that wasn't a communicator. Do you think everybody's a treatment coordinator? Do you think I can train everybody to be a treatment coordinator? No, I cannot train everybody because some people don't have what it takes. You have to connect fast and you have to gain a trust immediately. You've got one shot at it. If they think you're selling, you're done. If you think you're working for commission for the dentists, you're done. If you think you're a money-grabbing, insurance-driven employee that's based on profits, you're done. So, what do we have to do to engage a patient?